record for the health response.
Okay, I press record.
Okay, so we got record going on. Start video. All right, so do you see the recording? Okay,
Mm-hmm.
perfect. All right, we're going to start again. I'm just going to do the bottom so you don't get nervous.
Okay.
Just talk slow.
Okay.
If you talk slow, you can even probably have time just to put your head down and up and read the whole damn thing, okay?
Yes.
Just be comfortable. I don't want you to be stressed.
Okay.
All right. 3, 2, 1. Joining us this morning is Lakita Hollingsworth, RMA patient coordinator, patient liaison for the home-based primary care program with 20 years of experience in the medical industry. She joins us this morning to discuss home-based primary care house calls as the latest new service to improve outcomes, reduce costs, and provide patients stress-free care visits in the comfort of their home. Good morning, Lakita.
Good morning.
All right, Lakita. Infinity Healthcare Group of South Florida has developed a unique new service to meet the needs of a wide variety of your patients that address and improve the quality of life and healthcare for patients with chronic conditions.
Yes, here at Infinity Healthcare, we're always trying to come up with inventive ways to help improve our patient care. And one thing that we realize that many patients living with complex medical issues, accessing medical care in a traditional office setting is not always easy or safe for them. This is why we have designed a program that will bring these comprehensive services directly to our patients' home.
Excellent. All right, so you refer to providing services for your patients with chronic conditions that offers them a safe and secure environment to continue and maintain quality care by their provider.
Yes, that's correct. Our goal is to reduce the amount of hospital admissions and ER visits and provide optimal care to our patients, keeping them happy, healthy, and safe. And we can accomplish this by making primary care easily accessible to all our patients. So we can offer at home lab draws, electrocardiograms. We're going to do their vitals, monitor their blood pressure, their pulse, track their weight. And also we can complete their hospital follow-ups, make sick appointments, all in the comfort of their home. And then at that time, our professional staff can answer any and address any medical concerns that they might have.
Okay.
I think I messed up on it.
Interestingly enough, we know the population is getting older. And according to the U.S. Census, by 2034, there will be 77 million people 65 years and older, compared to 76.5 million under the age of 18. So that's considerably less younger people. So millions of people over 65 are very active and healthy. So what specific aging patients is this program designed for?
Yes, that's a good question. We designed this program for patients that are suffering from multiple chronic conditions such as diabetes, heart condition, walking and mobility problems, and much more. And these patients, because of these conditions, are unable to travel to the doctor's office. Also, we can complete their hospital follow-ups. So if they get admitted to the hospital and they're unable to come to the doctor's office, we can see them at their home to make sure that they're on their road to recovery. And another thing is that we can complete some sick appointments. So certain patients, their only means of resources is to call 911 and get admitted to the emergency room, even for the minor of issues. So we want to try to bridge that gap and keep them out of the hospital, because the danger of that is they leave themselves exposed to other ailments, viruses or infections that are just associated with being overpopulated in the hospital.
Wow. All right. So what has been your personal experience in going into these patients' homes?
I had a really, really wonderful experience with one patient. She was in and out of the hospital. She hasn't been able to see a primary care physician in over 2 years. So her only resource was to be in the hospital. So when I came to her house and explained to her the program, she was literally in tears because she know that she no longer has to wait around and hope, that she gets better. She knows she has access to medical care. And that is when I realized kind of that this program was so much needed. Can I do that over?
Yes.
Okay. Okay.
All right. What has been your personal experience in going into patients' homes?
I had a really great experience recently with a patient that was like in and out of the hospital. She hasn't been able to see a primary care physician in about 2 years. Um, the only resource she had was to call 911 and get services through the ER. So when I came to explain the services that we offer, she was literally in tears because she knew that she no longer had to wait, until things got worse, till things got bad to end up going to the hospital. She knew she had a service that can be provided for her in her home. So that's when I really realized that this service is very much needed for patients. And I'm sure a lot of patients are suffering like she was, and that need this type of care.
Uh-huh. So, Lakita, when a patient is discharged from a hospital after an illness or surgery, is there a time period that you should be seen by your primary care provider?
Yes, they need to be seen within 14 days. And the reason for that is that we need to try to ensure that they're following all the discharge instructions and that they're on their road to recovery. So there is some recommendation and requirements for that.
Okay. So, as a healthcare assistant, would you consider this program a pioneer healthcare service in primary healthcare?
Yes, as you alluded to earlier, the population of people, we're living longer thanks to modern medicine. And with that being said, as we age, different ailments start to arise. So we already see, I'm gonna start it over. As you alluded to earlier, the population is definitely living longer thanks to modern medicine. And as we age, different things can arise in our medical health. And we already seen a major increase in non-medical vans. They're everywhere to get patients from their home to the doctor's office. However, there's a definite need for patients that can't get into the vans and can't sit in the waiting rooms. So we're going to see more and more of this type of services pop up because it's a big need for it. And it's so thrilling to be a part of an office that is trying to expedite this.
Yeah, and you're a pioneer in that healthcare industry. So, all right. So, how many people in our nation are not receiving any type of primary care services?
I read an article in healthaffairs.org, and it states that approximately 4 million adults that are homebound are having difficulties in reaching primary care. So it's quite a few.
Wow. All right. Can you tell us where our viewers can learn more about home health visits as patients of Infinity Healthcare Group?
Well, this is exclusive to our patients, so you need to be okay. Let me go over. This is something that is exclusive to our practice. So you can call call the number 954-586-8058 or 954-741-3304. And they can ask some questions and try to get you established with the practice if there's something that can meet your needs.
All right, listen, you're going to have to give me one number.
Oh, okay. They told me to give you two.
And the reason
Okay.
I say that is because it becomes too confusing
Yeah.
to the viewer.
Okay, no problem. I can just use
So
the
let's do
first
this
one.
again.
Okay.
Where can our viewers learn more about home health visits as patients of the Infinity Healthcare Group? And do make sure that you add that they need to be evaluated.
Oh, okay. Okay. Well, patients can they can call the 954-586-8058, and they're gonna call us and be how you want me to say that?
Okay, I want you to say first we evaluate you
Okay.
as a patient of Infinity Healthcare.
Okay, got it.
And please call us to start the evaluation process at
Okay. All right. So you can call our office to be evaluated for this service. You can call 954-586-8058. And again, that is to get established with the practice and get evaluated for the possibility of this service if needed.
Excellent. All right. Thank you so much, Lakita, for joining us this morning with Infinity Healthcare Home Healthcare Service to address the needs of patients that are homebound. Thank you for your service.
You're welcome.
All right, hit the record button,
Mhm.
okay? Is it off?